Hi, and welcome to the narration for Module 10, The Functional Anatomy of the Hip. The objective for this module is to explain the interdependent relationships of the hip complex as it works synergistically to produce force, reduce force, and stabilize the entire kinetic chain during functional movements. Each muscle in this complex has a function in all three planes of motion. First, we will discuss the hip flexors, including the psoas, the iliacus, the sartorius, the tensor fasciae lata, the rectus femoris, the adductor longus, and the pectineus. The psoas originates in the bodies and transverse processes of the lumbar spine. It then inserts in the lesser trochanter of the femur. The isolated functions of the psoas are that it flexes the hip, it synergistically assists with hip external rotation. It extends, laterally flexes, and rotates the lumbar spine. The integrated function of the psoas is that it decelerates femoral internal rotation at heel strike. It assists in stabilization of the lumbar spine during functional movements, and it decelerates hip extension while accelerating hip external rotation. There are several chain reactions that can happen with the psoas. A tight psoas inhibits the gluteus maximus, thus increasing the compressive forces on the lumbar spine. A tight psoas also inhibits the lumbopelvic hip complex intrinsic stabilization mechanism, which increases translational and rotational stress in the lumbar spine during dynamic movement. The iliacus originates on the iliac fossa and inserts on the lesser trochanter. The isolated function of the iliacus is hip flexion and hip external rotation. Its integrated functions include deceleration of hip extension and internal rotation, dynamic stabilization of the lumbopelvic hip complex. The iliacus is involved in several chain reactions. It compensates for weakness of the other hip flexor muscles, and it compensates for weak intrinsic core stabilizers. The sartorius originates on the ASIS, or the anterior superior iliac spine. It inserts on the proximal medial surface of the tibia. The isolated function of the sartorius is hip flexion, abduction, external rotation, knee flexion, and internal rotation. The integrated function is that it decelerates hip extension, adduction, and internal rotation, and it decelerates knee extension and external rotation. The sartorius has a chain reaction. Transverse plane compensation at the hip, or internal rotation, and knee, tibial external rotation, lengthen this muscle. The tensor fasciae lata originates on the outer surface of the iliac crest, just posterior to the anterior superior iliac spine, and it inserts on the proximal one-third of the iliotibial band. The isolated function of the tensor fasciae lata is hip flexion, abduction, and internal rotation. The integrated function is that it eccentrically decelerates hip extension, adduction, and external rotation, and it dynamically stabilizes the lumbopelvic hip complex. Chain reactions for the tensor fasciae lata include that it compensates for weak gluteus medius, and it accelerates femoral adduction via tibial abduction during weight bearing and femoral internal rotation function. The rectus femoris originates on the anterior inferior iliac spine and on the superior rim of the acetabulum. It inserts on the patella. The isolated function is knee extension and hip flexion. The integrated function is that it eccentrically decelerates knee flexion, adduction, and internal rotation at heel strike. It dynamically stabilizes the knee. It accelerates extension and external rotation during triple extension, and it decelerates hip extension and knee flexion. Just in case you don't know what triple extension is, this is an explosive movement that involves the contraction of the quadriceps, the gluteals, and the calf muscle, and it's used by athletes for acceleration or jumping. And these three muscles, the calf, the quads, and the glutes, have to contract together for that explosive force to be produced. The chain reactions for the rectus femoris are as follows. When the rectus femoris is weak, it increases an eccentric load to the patellar tendon. When the rectus femoris is short, it creates an increased anterior pelvic tilt, which inhibits the gluteus maximus, thus creating kinetic chain compensations. Now we'll discuss the hip adductors. The pectineus, gracilis, adductor brevis, adductor longus, and adductor magnus. The pectineus originates at the pectineal line of the pubic ramus and inserts on the pectineal line of the femur. The gracilis originates on the pubic symphysis and inserts on the medial tibial plateau or the pes anserine. The adductor brevis originates on the inferior pubic ramus and inserts on the pectineal line or the linea aspera. The adductor longus originates on the medial portion of the superior pubic ramus and inserts on the linea aspera of the femur. The adductor magnus originates in the ischiopubic ramus and on the ischial tuberosity. It inserts on the linea aspera of the femur and the adductor tubercle. The isolated functions of the adductor complex include that it adducts, flexes, and internally rotates the femur. The magnus adducts, extends, and externally rotates the femur. Integrated function includes that the adductor complex works synergistically with the gluteus medius, tensor fasciae lata, and quadratus lumborum for frontal plane stabilization during stance phase. They assist in eccentric deceleration of hip extension, external rotation, and abduction. The adductor magnus assists with hip extension and external rotation. For chain reactions, a short adductor complex will increase frontal plane stress at the knee and the hip. Short adductors cause myokinetic inhibition of the gluteus medius, leading to compensations by the quadratus and tensor fasciae lata, or IT band, for frontal plane stabilization, leading to lumbar spine and SI joint dysfunctions. Now the hip internal rotators. This includes the gluteus minimus and gluteus medius, the anterior fibers, the tensor fasciae lata, the adductor longus, the adductor brevis, the pectineus, and the hamstrings, just the medial hamstring. The gluteus medius originates on the posterior ilium and inserts on the greater trochanter. The isolated function of the gluteus medius is to AB or abduct and internally rotate the femur. The integrated function is that it dynamically stabilizes the lumbopelvic hip complex during single leg stance. It eccentrically decelerates frontal plane hip adduction. The gluteus minimus originates in the ilium and inserts on the greater trochanter. Its chain reactions are that in the presence of the weakness to the posterior fibers of the gluteus medius, the anterior fibers of the gluteus medius will compensate, the gluteus minimus will compensate, and the tensor fasciae lata will compensate. Now the functional anatomy of the hip extensors, including the gluteus maximus, the hamstrings, the adductor magnus, or the posterior head vertical fibers. The gluteus maximus originates on the posterior gluteal line, the posterior sacrum, the posterior coccyx, and the sacrotuberous ligament. It inserts on the iliotibial tract and the gluteal tuberosity. while we're discussing the insertion and origin of the gluteus maximus, I just want to mention a study that I read that was really interesting. It was looking at the difference between the gluteus maximus of a human to the gluteus maximus of a baboon. And as you know, baboons walk upright, but only for very short periods of time. They don't stay upright as long as we do. And what the study demonstrated was that the human gluteus maximus actually inserts much higher, and is the one reason that we walk upright for long periods of time. The baboons have to use their paraspinals to stand upright, where we use our gluteus maximus. And this was interesting to me, maybe explaining why people with weak gluteals often have back pain and back problems. The isolated function of the gluteus maximus is to extend and externally rotate the hip. Now remember that if the foot is planted on the ground and the hip performs extension, it would lift the trunk up. So don't just think of the leg going backwards, but also think of the entire trunk going into a backward hip extension. So it's not spine extension, but it's hip extension. It would actually be, let's say, you lifting your back up. And as you look at the squat video that I inserted into this module, please notice how the gluteus maximus does pick up the trunk. The integrated function of the gluteus maximus is that it decelerates hip flexion, adduction, and internal rotation during the stance phase. It decelerates tibial internal rotation via the iliotibial band, and it concentrically accelerates hip extension and external rotation to get that triple extension. Chain reactions for the gluteus maximus. A short psoas will inhibit the gluteus maximus. A weak gluteus maximus can cause patellar tendinitis. A weak gluteus maximus can cause posterior tibialis tendinitis and plantar fasciitis. A weak gluteus maximus can cause Achilles tendinitis. Now the functional anatomy of the hip abductors, the gluteus medius, the gluteus minimus, and the tensor fasciae lata. The isolated function of the hip abductors is that they abduct the femur and they internally rotate the femur. This includes the tensor fasciae lata, the gluteus minimus, and the anterior gluteus medius. The posterior fibers of the gluteus medius externally rotate the femur. The integrated function is that they decelerate frontal plane hip adduction. The gluteus medius assists in eccentrically decelerating transverse plane hip rotation. Chain reactions for the hip abductors. Following ankle sprains, it has been demonstrated that the gluteus medius has decreased electromyography activity. This leads to synergistic dominance of the tensor fasciae lata and gluteus minimus. These muscles internally rotate the femur, which increase stress in the lower leg. A short psoas creates a sacroiliac joint dysfunction, which creates both myokinematic and arthrokinematic inhibition of the gluteus medius. Now the functional anatomy of the hip external rotators. This includes the gluteus maximus, the sartorius, the piriformis, the obturator internus and externus, the gemellus superior and inferior, and the quadratus femoris. The piriformis originates on the anterior surface of the sacrum and inserts on the superior aspect of the greater trochanter. The obturator internus originates on the obturator foramen and inserts on the greater trochanter. The obturator externus originates on the superior and inferior pubic ramus and the external surface of the obturator foramen, and then inserts on the trochanteric fossa. The gemellus superior originates on the ischial spine and inserts on the greater trochanter, while the gemellus inferior originates on the ischial tuberosity and inserts on the greater trochanter. The quadratus femoris originates on the lateral border of the ischial tuberosity and inserts on the quadrate line below the intertrochanteric crest. The isolated function of the hip external rotators are to externally rotate the femur. The piriformis and the obturator internus abduct the femur. The integrated function is that they eccentrically decelerate hip internal rotation. They concentrically accelerate hip external rotation. The hip external rotators work as a major pelvo-femoral stabilizer during functional movements to help maintain stability and proper function of the lumbo-pelvic hip complex. When the hip external rotators are short, especially the piriformis, they can create a sacroiliac joint dysfunction, leading to lumbar spine dysfunction. The external rotators can become synergistically dominant to compensate for a weak gluteus maximus, a weak biceps femoris, or weak gastrocnemius and weak gluteus medius. In summary, the hip complex includes a large group of muscles. Although there may be a primary plane of motion where a muscle is the strongest, all of these muscles function in all planes of motion. All of these muscles also function eccentrically, isometrically, and concentrically.